Proper squatting is one of those basic human movements that everybody needs to know how to do correctly, but in reality, few people do. One of the main problems that we have is because of our tight hips, we kind of relearn how to squat in order to work around tight hip flexors, inhibited glutes, things like that. And so we develop movement patterns that actually place too much stress on our knees and on our lower back. And so, I'd say probably 95% of the people that I've ever worked with, I've had to reteach how to squat in some way or another. Even people that have extensive strength training backgrounds usually are not squatting correctly. And also, judging by the amount of people that I get asking me and emailing me about, certain squatting movements causing them knee pain or lower back pain, things like that, it's pretty apparent that this simple, basic human movement is something that most people really need to think about whether they're doing correctly, and probably need to make a few corrections. What I'm going to do is show you the two most common errors that I see and how you can correct them. And the first one actually deals with the knees. If you get a lot of pain in your knees from squatting, then odds are you're probably doing something along this lines here. And so what I'm going to show you here, I'm going to show you from the side. And this is what I call knee squatting. Other coaches have different names for this, but the phenomenon is basically the same, where you basically break at the knees first, and then you just keep bending the knees, bend the knees, bend the knees, bend the knees, and then some people might actually even come up on their toes, or might kind of sit back a little bit, but basically they end up down in this position here. And so you can see that my knees, in relation to my toes, my knees are actually pushed out past my toes, and you can see my butt is directly over my heels. And so this is what's called sitting down into a squat. And this is actually not what you want to do. You don't want to sit straight down, because this places a lot of excessive stress on your knees. What you want to do is sit back into a squat. So this is what I call hip squatting. And so what you want is to break at the hips first, push your butt back, and then keep pushing your butt back as you come down. Now, look at the difference here. Look at my knees in relation to my toes, and where my butt is in relation to my heels. This is where most people end up, and this is where you want to end up. And so you can see that by pushing the butt back, I'm getting the butt back behind the heels more, and I'm keeping the knees more directly over my feet. Instead of pushing them out over my toes, they stay back like that. Now, there's a huge difference biomechanically between those two movements. And so even something as simple as that can make a huge difference on the impact that it's going to have on your knee joint. Remember, how much weight you move is secondary to how you create the movement. If you're creating the movement wrong, then you're going to cause more damage than you are doing good. And so you need to learn how to just perform a basic bodyweight squat correctly before you can really worry about having to put load and stuff like that. So this is just a really basic human movement that we need to get down. So again, break the hips first, push the butt back, and keep sitting back into the squat and end up down in this position, rather than breaking at the knees first and driving the knees forward and sitting straight down into the squat. So again, that'll take a lot of stress off your knees. I absolutely 100% guarantee you that if you feel that squatting causes you knee pain, you are knee squatting. I'll guarantee it. It's not even a question. You check your form, and the easiest way to tell what's happening at your feet. Where is your weight on your feet? Because your weight should always be a little bit back on your heels. You should have like a 60-40 weight distribution, heels to forefoot. So a little bit of weight back on your heels before you start. And then if you can't keep that 60-40 weight distribution as you come down like this and back up, then your knees are traveling too far forward. So if you come down and you feel like that weight shifts to your toes and your heels actually even start to come up off the ground, you're knee squatting. And so you have to correct that, because again, you're going to tear your knees up. You have to squat. Everyone has to squat. Sitting down into a chair and standing up is squatting. It's a basic human movement. So to tell me that I can't squat because it hurts my knees basically tells me that you can't create one of the most basic human movements, which is pretty sad. It just means you're going to be really limited in your daily functions, as well as your ability to exercise and get gains from your exercise program. So again, make sure that you're sitting back into the squat, not sinking straight down into it. And again, paying attention to what's happening at those heels is going to be real important. Keeping that weight back on your heels as you're coming down. As soon as you feel that weight start to shift to your toes, then you need to stop and correct your body positioning. So the second thing, that addresses knee pain. The second issue that people have is with their lower back. And there's actually two things that can happen. One is on the way down, and that is when you let your tail tuck. And so what I mean by tuck is as you're coming down, all of a sudden you kind of let the tail tuck in like that. What you have to be able to keep your abs nice and tight, your belly button drawn in, think tall and thin, and then be able to keep that set as you squat down so that your tail doesn't tuck as you come down. Because if that tail tucks and you're down here, and then when you stand back up, look what happens, that tail comes back to this position here. Well, guess what muscle's responsible for bringing you back to that position? Your lower back. And so there's a couple issues there. One is core strength, learning how to brace the abs. And there's some controversy in strength training circles about the draw-in versus bracing. Both have their merit. So again, I think thinking tall and thin and just kind of getting those abs engaged is a really good cue for you whenever you're squatting in order to get the abs set the way that you want. And so, but if you let that tail tuck, and then you come back up and you let it straighten back out using your lower back, and then you put load on yourself, that's just a recipe for disaster for your lower back. So again, you need to make sure that you're not letting that tail tuck. So you need to be able to achieve a full range of motion body weight squat, which is coming down until your upper thighs are parallel with the ground without that tail tucking, and being able to keep your weight back on your heels before you even think of adding load to this movement. If you can't do that, you need to work on your hip mobility. The issue is hamstring length. If you've got tight hamstrings and weak abs, then as you're coming down, you reach the end of your hamstrings range of motion, your abs can't control it anymore, so they break and your pelvis tucks forward in order to continue to sink down and create a false range of motion for you. So you need to work on opening the hips up, opening the quads and hip flexors up, lengthening the hamstrings. Those are going to give you what you need in order to achieve good squat depth. And then lastly, on the way back up, let's say that you are able to come down and maintain a good neutral lower back as you come down. But then as you come up, your very first movement is your shoulders rising up like that. What you want is for your hips and shoulders to come up at the same rate. This needs to be your initial movement, not that. A lot of people have a tough time distinguishing between lumbar flexion and hip extension. And so a lot of times people will actually initiate the squat by flexing the lower back and bringing their shoulders up. So if you feel like your very first movement is your shoulders rising up and your chest kind of coming up rather than your hips rising up off the ground, again, you're initiating the movement with that lower back, and that is a recipe for disaster. You don't want that lower back creating movement. You want this stabilizing and the movement all coming from the hips. So again, that tail tucking or the shoulders rising on the way up is just an indicator of just bad mechanics, an inability to hold the core strong and power the movement where we want it to. So again, if you do those things, if you make sure that you're hip squatting, meaning that you're pushing your butt back and you're coming down into this position at the bottom, and then on the way up, you're rising up, squeezing the glutes, pushing through the heels, and your hips are coming up off the ground first, not your shoulders rising up. If you're able to achieve that form, then I absolutely guarantee you that any lower back or knee pain that you're having is going to go away. Lower back and knee pain is not normal. It's just an indicator that you're doing something wrong. Everybody can squat. Again, that's the way the good Lord put us together, is to be able to create these movements. But when He put us together, He designed us to operate a certain way. And when we deviate from that way, that's when we start opening ourselves up to injuries and stuff like that. So again, just being conscious of how you're creating the movement rather than concentrating only on how much weight you're moving will go a long way towards your long-term results and your ability to keep from hurting yourself and setting yourself up for injuries down the road through your exercise program, which is never what you want to have happen. So again, that's some basics on squatting. Sitting back, making sure the tail doesn't tuck, and making sure that the shoulders aren't rising up first as you stand up. If you can achieve those 3 things, then you're well on your way to doing a good functional squat. Again, practice with body weight. Just come down as far as you can, maintain good functional form, work on increasing your mobility, work on increasing your functional range of motion. Once you can achieve a good functional full range of motion squat, then you can start loading yourself. You definitely want to get strong in this movement, but you need to make sure you can create the movement correctly first so you don't injure yourself in the process.